Did you know there's a relationship between blood pressure and your posture? See, the pressure in your body, in the blood vessels, can actually change depending on what you're doing, so in terms of activity and physical demand, but it also can be affected by your physical posture, how you're holding yourself. And in this video, I'm going to show you exactly how it is. In fact, what I'm going to start off by doing is showing you how it's all related together. See, now you're going to have to excuse my drawings. I'm a better practitioner than I am at drawing, but watch this. Let's say we've got a person here. I know it's a blob, but let's put a head on there. Okay, maybe a smiley face. Listen, I warned you, okay, so don't judge me. All right. Now, what we have in your abdomen here, we've got two main compartments. So let's separate those two compartments like that, and that is your abdominal diaphragm. So that's the main muscle we use to breathe. What we have also is up here. This is where your heart is, all right? And the heart has a little attachment to the diaphragm, so that connects there. Then let's add in some other organs. So let's add in some lungs, for example. So your lungs are around there, and another one around there. I know it gets worse, so just bear with me on this one, okay? And then what we're going to have is we're going to draw in all the other, we're just going to create some squiggly lines underneath here. So all these other organs, all your intestines, your liver, it's over here, all that kind of stuff. And your stomach is right there, okay? So all your other organs are there. Now, we know that from your heart, we've got all of the arteries that are going and supplying the rest of your body through there. If you have a nice balanced posture, everything's working well, there's not much excess pressure through these cavities, is there? However, if you compress through there by really rounding your shoulders, really bring pressure through there, you can see how it will be compressing that area. So think about just for a moment your heart a bit like a water balloon with water pipes coming out of it. If you squeeze that water balloon, it's going to increase the pressure in that whole system. And that's how blood pressure can go up. So what you can do is, one, you can just think about straightening your posture, bring your shoulders back, not just from your hands like that, but really bring your shoulders back to this position here. That just takes your whole posture in a much better position. Just so we know this as common sense, don't we, that this looks better and it may then function better as well. The other thing we can think about, remember we spoke about this diaphragm? Well, we want to think about using our lower abdomen to breathe with, and rather than up here. So the way we do that is we use our diaphragm. So when you breathe, just using your diaphragm, like quiet breathing like you and I are probably doing right now, you can go, and that diaphragm pushes all of these down, but it increases the pressure through, so it increases the space and decreasing the pressure, but increasing the pressure and decreasing the space down there. It also pulls a little bit on the heart, again, further de-stressing you there. There's been many studies showing how when you just breathe quietly using deep diaphragmatic breaths, it really helps relax you and get you to a nice relaxed state. And that's probably one of the reasons why that happens. So think about if you have high blood pressure or you ever get stressed, just do the simple exercise and just take it nice and easy. Of course, if you have medication, seek professional advice before you think this is the only solution. This should certainly help and make sure everything should be where it should be. Thanks for watching this video. Hope you enjoyed it.